Hey everybody, Christian Brindle here, Medicare health plan expert and specialist, and today I'm here to react to a new Medicare commercial that they have airing on the airwaves right now during the Medicare annual enrollment period. It's currently, as I record this, October 20th, and William Devane is the new culprit that is spreading misinformation, propaganda, and just very, very little information while making incredibly big promises in the process, okay? Of course, you know, like all these other celebrities that do these kind of commercials, Joe Namath, Jimmy J.J. Walker, William Shatner, you can go down the entire list here. You know without a shadow of a doubt that he's simply just reading off a teleprompter. He has no idea what he's promoting or what he's recommending. And what kind of organization he's pushing people to, most importantly. Not so much that the plan itself that they're recommending is such a bad thing if it's, you know, properly picked out and, you know, it's something that, you know, is chosen with care by someone with expertise. But when it's pushing someone to just a massive call center where someone just literally started working there in the last couple of weeks because they stocked up, or they stocked up on staff for the open enrollment period, you know that that's problematic. They're recommending plans that don't have prescription coverage to diabetics with insulins. I've seen it myself firsthand, and so it's just an absolute tragedy. And let's just dive right into and just dissect this horribly abomination of a commercial, okay? Let's go.
Hi, William Devane here. It's the Medicare annual enrollment period, and this year it's simple. 1. Before the deadline, call the number at the bottom of your screen.
No, it's simple. Just call the number at the bottom of your screen, and that's all that you have to worry about, right? But it's not so simple. Medicare is not necessarily simple. Medicare plans have a lot of working parts. Medicare plans have networks. You have to make sure that your doctor, your provider is in a network, especially for the type of plans that they're actually pushing people towards, which is Medicare Advantage plans. And it says right here at the bottom of the screen, right here in small letters, of course, says extra benefits require enrollment into a Medicare Advantage plan. Part B give back benefit availability varies by zip code and plan. You must continue to pay your Medicare Part B premium. But they don't want you to see that first and foremost, because then people would be like, oh, this isn't any different than what I already have. It's just mindless, meaningless propaganda. And it's just complete, absolute garbage that's being spewed on your airwaves.
2. Check your zip code for a Medicare Advantage plan with $0 premiums, prescriptions, dental care, and the benefit that adds money back to your Social Security check every month.
So, first of all, there have been a lot of new rules and regulations that have come out, supposedly, that are being enforced on organizations like this that say they're not allowed to make claims like this, because there's so many areas that don't have the benefits that they're talking about in their Medicare Advantage plans, particularly the money back into Social Security benefit. What that is every single person on Medicare pays what's known as the Medicare Part B premium. In 2022, that premium was $170.10 a month. In 2023, it's going to be $164.90 a month. I talked about it in a video on our channel, so go check that out if you want to know more information about that. But some of these Medicare Advantage plans have a benefit to where they will work with Medicare and work with Social Security to pay that premium down for you a little bit each month. Now, in some markets, it might be 10, 20, 30 bucks a month. Some markets don't even have the benefit at all. And some markets have a lot of it, you know, 150 a month, 160 a month. But the markets that do that much of it are incredibly few and far between. And that's not everything you want to look at when it comes to a plan. So let's say there's a plan that does $50 back on your Social Security, but let's say it doesn't cover your prescriptions and it costs you $300 a month in prescription costs because your prescriptions aren't covered. Are you better off with that? Probably not. Let's say you have a doctor you're tied to, you trust them. You get extra $50 a month back in your Social Security check because of that Part B premium reduction benefit, but you can't see your doctor. You have to change your doctor, and it just puts you in a dramatically uncomfortable position. Is that a good thing for you? Probably not. You have to pick everything that comes with these plans. You can't just pick the benefits you want, and these types of horribly awful commercials, they just don't really want you to know that. They don't want you to see this video today.
3. You'll find out what you're eligible for. The annual enrollment period has a deadline, so don't delay, call now.
I called to find a plan that covers more of my dental.
Okay, so this says Richard F. Okay, so it says actual caller, but paid endorsement. So, so it's a real caller, but they had to pay him to give positive feedback. That's what I get out of that. I mean, any legitimate business or any legitimate organization will have satisfied customers that are willing to speak positively about their product or what they're doing. They don't have to pay them.
Expenses.
I call every year to make sure my
Sharon D. Actual caller, paid endorsement. You can't make this up.
doctor is still in my plan.
I called to see if my zip code has a plan.
Andrea B, I think that's what it says. Actual caller, paid endorsement. All these people have to be paid to say something good about their terrible service.
With the benefit that adds money back to my Social Security check.
I call every year.
Gail B, same thing. I don't know if you caught it, but it said actual caller, paid endorsement. Okay, so let's actually see what this new fine print says. It says based upon actual Toggle Health, I think that's what it says, Insurance LLC, call recordings from October 1st from 2019 to December 7th, 2021. Oh, so it's actually even old, these reviews. The Medicare annual enrollment period is from October 15th to December 7th. Yeah, okay. Duh, no, nothing there.
Call to find out the changes to your plan and see if you're eligible for anything new. The annual enrollment period has a deadline, so don't delay. Call now.
That snake, I mean, he has no integrity. He's just taking the check to let them use his likeness to really just, to me, put people in a lot of very bad situations. I've seen a lot of people be damaged by calling these numbers. I would not recommend it. Let's read this fine print. Okay, don't delay. Get what you deserve. Call now. 2023 Benefit Helpline is not affiliated with or acting on behalf of any government agency or program. Shocker, right? Outside of the Medicare annual enrollment period, members can enroll in a plan only if they meet eligibility requirements. The Medicare Coverage Helpline is owned and operated by Together Health LLC, a licensed agency, health insurance agency services. So all they are is they're a glorified insurance agency that is probably backed by venture capital money to push their advertising agenda and their propaganda on a national scale. They're not doing anything that no one else is doing. They're not doing anything special. They're just doing things in the most sleazy way possible to get you to call them. Let's see. Medicare Advantage plans, Part D prescription drug plans. It says we do not offer every plan available in your area. Of course they don't. Most brokerages don't, but they in the past they've acted like they did. Yeah, guys, folks, this is just very tragic and very, very problematic to me. Don't fall for this stuff. I implore you, don't fall for this stuff. I've seen so many just horrible situations that people get placed into. The people that are taking your calls are taking calls from all 50 states. There's no way they can know the plans everywhere. You should be working with somebody that is an expert, somebody that didn't just start a couple weeks ago, somebody that's not sitting somewhere in a cubicle in a call center, that just really knows their stuff, right? A real, actual expert in the business. My agency is that. My agency's name is Christian Brindle Insurance Services. I've published multiple books on Medicare. I host the most popular Medicare podcast in the country, the Everything Medicare podcast. And we know Medicare. We work with a litany of different plans. I encourage you, and before you even consider calling these folks, call us, get an opinion on your plan. We're happy to help. We're licensed in 46 states. And I promise you that you'll get a quality of care that you won't get from calling organizations like these. If you enjoy this video and you feel like it brought good awareness in terms of what is actually going on and what's behind the scenes of some of these horrible, awful propaganda commercials, do me a favor, drop a like on the video because it helps more people on Medicare find the video and it might save them from falling into this trap. Also, comment your thoughts down below. Does this outrage you like it does me? I'd love to have a dialogue with you about it. Make sure to subscribe for future Medicare updates, real information, educational information without an agenda. And yeah, just don't fall for these awful commercials. And we'll see you at the end of the December 7th deadline. Thanks so much, folks, and we'll talk to you soon. Later.